Good evening, folks. Gracia Pierre-Pierre here, sports medicine specialist, aka Black Stallion. Today we're going to talk about impingement syndrome, which is a condition that causes pain in the anterior aspect of your shoulder. The reason I'm talking to you about it today is because I've been dealing with that condition for the past 3 months and I just got over it. This talk is brought to you by Embed Productions for all your editing needs and by Physician Thrive, a group of advisors that help physicians manage their money without stress. Today we're going to go over the definition, the causes, the symptoms, the evaluation and management, and prevention of the impingement syndrome. Impingement syndrome is a condition where the acromion, which is part of your shoulder blade, digs into the rotator cuff, a group of 4 tendons that allow you to move your shoulder, or the bursa, which is a fluid-filled sac that allows the same tendons to glide freely, causing pain. Rotator cuff pain is common in athletes, in particular the overhead ones that participate in sports such as swimming, baseball, in particular the pitchers, tennis. It can be seen in middle-aged people who do repetitive lifting or overhead activities such as construction workers or painters. It can be seen in people that sustain minor injuries, such as reaching suddenly for something. And sometimes it is here for no apparent reason. What are the symptoms of the impingement syndrome? So at the beginning, the symptoms are mild. You have minor pain that is present both with activity or at rest. You have pain radiating from the anterior aspect of the shoulder to the lateral aspect of the arm. You can have sudden pain with lifting or reaching movements. And as athletes that participate in overhead activities, they can have pain when they throw the ball or in the tennis players that are serving the ball. Frequently, patients don't come at the beginning of a condition. So, as the problem progresses, the symptoms increase, causing pain at night, loss of strength and motion, difficulty doing activities that place the arm behind the back, such as buttoning or zippering. If the pain comes on suddenly, the shoulder may be severely tender. All movement may be limited due to pain. When you go to the doctors, what can you expect? You can expect the doctor to take a history, to perform a physical exam, to get an x-ray, to have an idea of what's going on with the bones, and then it will send you to physical therapy because this is the treatment. Now, if the pain is so debilitating, causing you not to be able to sleep at night, it can give you a shot of steroid to kind of cool down the pain that will allow the patient to participate in physical therapy. Now, upon follow-up 4 to 6 weeks later, if the pain improved or even resolved, great. If not, the doctor will get an MRI to have an idea of what's going on with the soft tissues, such as the tendons, the bursa, and the other tissues inside the shoulder joint. Depending on the pathology uncovered by the MRI, the doctor can decide to treat further with injectables and then continue with physical therapy, or refer you to a surgeon for surgery. How can you prevent the impingement syndrome? So you need to observe great body mechanics if you're a construction worker, if you're a painter, to just name these 2. Your technique should be flawless if you're an athlete. And also, if you're an athlete, you need to save some time to work on your shoulder to strengthen your rotator cuff. Here you have it. We talked about the definition, the causes, the symptoms, evaluation and treatment, and prevention of the impingement syndrome. If you have any questions, please address them to my Facebook page at Black Stallion ND. This is Gracia Pierre-Pierre, sports medicine specialist, aka Black Stallion, and this is how you mind your own business.